The semen count is on the lower side. Did you get to know this for the first time? I'm wondering what is your feeling. I'm sure this has kept you thinking the whole night. How can my count be on the lower side? You would go into your past trying to figure out what led to this. Thoughts are pouring in, and once you are done with the past thinking, then you would probably worry about the future. Thinking about whether I'll be able to father my child. Will I have to undergo some treatment? Will I need IVF? Oh my God, you will go on and on and on. But I'll stop it here because I want to give you some information so that I educate you on this aspect. If you are someone who is sailing in the same boat, then please watch this video till the end because this is going to be a useful watch. Hello everyone, myself Dr. Indu from Samruddh Fertility and Urology Center. Today I am going to dive into this topic that affects many couples trying to conceive, bring the new bundle of joy in their life, especially when they are having lower sperm count. Have you ever wondered how low count is a low count? Stay tuned because I'll explore this question, and in this video I am going to discuss about the 7 different reasons behind it. So how low is low sperm that is going to impact your fertility? Before I go into the details, let me share some statistics. Worldwide, infertility affects 50 to 20% of the couples. Infertility is both a clinical problem, a public problem, which affects the life of the couple, and their social environment is affected immensely. Also, it impacts the healthcare services. When it comes to male factor infertility, the male is solely responsible in about 20% of infertile cases and is a contributing factor in another 30 to 40% of infertility cases. As male and female causes often coexist, it is important that both the partners are investigated for infertility and the management is done together. Now, what is the test that will tell that the count is on the lower side? This test is semen analysis, and I should tell you this, that you must get the test done in a good fertility center because that is more ideal. The standard semen test is actually a surrogate measure, and this is the only way that one can know about the male's fertility potential in a clinical scenario. What is a normal sperm count? According to WHO criteria, when a gentleman is having 15 million and above sperm count per ml, then it is said to be normal, and anything below this is often considered as a low count, and in medical terminology we call this as oligospermia. Now this can be further categorized into 3 different categories. One is mild, where the count is between 10 to 15 million per ml, moderate oligospermia when the count is between 5 to 10 million per ml, and severe oligospermia where the count is less than 5 million per ml. Now you should do the test on 2 different occasions at 1 month apart to say that or to conclude that you have low count. Now coming to the reasons. There are several reasons why some might have a low sperm count. Coming to the first cause. One of the commonest cause is the lifestyle factor, that is your overall health. Now, if you are someone who is having poor diet, lack of exercise, do not exercise regularly, you smoke a lot, you have a habit of having a lot of alcohol, then also if you are somebody who is very obese, then these are the contributing factors for lower sperm count. The second reason could be your hormonal imbalance. Hormones play actually a very crucial role, a very important role in the sperm production, and any disruption in the hormonal level will definitely have an impact on the sperm production. These hormones are thyroid dysfunction, if prolactin levels are in the higher side, if the testosterone is on the lower side, the FSH levels, LH level, these are hormones that are coming from the brain. If this is also altered, then this will have an impact. So have you checked your hormones if you have found out that your count is on the lower side? If not, then definitely visit your fertility consultant. The third factor or the cause is the environmental factors. Now definitely there is a lot of exposure to toxins such as insecticides, pesticides, fungicides, smoking, and radiation. Radiation is an occupational hazard, and when these are in excess, then these are the potential reasons for low sperm count. Also, you have to note that prolonged exposure to higher degree of temperature such as hot tubs, saunas, people who are working in the factory might also have an impact on their sperm production. Fourth reason is infection, especially urogenital infections, and they are commonly sexually transmitted diseases. There are many different kind of infections such as chlamydia, syphilis, tuberculosis, bacterial infections, recurrent infections also. So if you are someone who has this history, then you have to bring it to the doctor's notice, because this also has an impact on the sperm count. The reason number 5 is the chronic illness. Now these days we do come across history of diabetes, hypertension, and if you're someone who is taking medications for diabetes and hypertension for a longer period of time, then this may have an impact on the sperm count. So it is very, very essential that both the conditions are kept under good control. Reason number 6 is surgeries. If you have had inguinal hernia operation, if you have had surgery for undescended testes, if you have had surgery for your lower spine, then these can have an impact on the sperm production. Reason number 7 is medication or drugs. When taken for a prolonged period of time, then they have an effect on the sperm number. And these are antidepressants, anti-anxiety medications, anti-epileptic medications. We call them as a psychotropic drug. That is, they act on the brain and they basically inhibit the reproductive hormones, and so it affects the sperm production. If you are someone who is consuming testosterone supplements, steroid supplements for bodybuilding, then be aware they are not right for the sperm health. Also, if you are someone who is taking anti-cancer medications, if you are taking a longer period of steroid hormones for some kind of immunosuppressive conditions, if you are taking antibiotics, especially antifungal such as ketoconazole, or if you are someone who is taking antacids for a longer period of time, then they can also impact. So these were the different reasons, causes. If you are really concerned about your sperm count, then please do not go into the detail of understanding by Googling, because it will confuse you. So it's better that you make one visit and take a consultation with a fertility expert, because they will help you determine the cause of the low sperm count. They will recommend appropriate treatment for the same. In the meantime, what is in your hand is take control of your lifestyle factors, because then that can potentially improve your sperm count, isn't it? So concentrate on having a healthy diet. See to it that you are exercising regularly every day without missing even a single day. Avoiding smoking. If you stop smoking is really good. If you also reduce or stop taking alcohol, it will be really good. If you are someone who is having a lot of pressure, then yoga, meditation will also help. This will all have an impact or improve your sperm count and sperm health. So remember that when you are wanting to try for pregnancy, then your overall reproductive health is extremely essential, because your health means sperm health. If you have found this video useful, helpful, powerful, then do share with someone who needs. And thank you for watching till the end. I shall see you soon with the next video, where I'll be talking about how to manage these cases of low count and tell you how it helps and what kind of treatment is feasible and possible. Thank you for watching.